Ladies and gentlemen, I would like to start with this Eurobarometer study. We had been waiting for a long time to get a study. It's a very peculiar report. The contents are a lot of very strange information and conclusions and no discussions at all. Anyway, the report states that Europeans 15 plus make regular dental visits, most often for prophylactic reasons, choose the private sector as if there was any choice in most countries, and have good access to dental care. So my question here is, are there any problems? Why would dental care be politically important? That's in a way the message the report gives. But when you take it and look a little bit deeper in it, so you see, as already Ken Eaton mentioned, less than half of these people, 15 plus, had all their own teeth, and a third had lost very many teeth or were totally edentulous. And there were low edentulousness in Sweden and Denmark, high in Hungary, Estonia and Poland. About a third of the respondents had dentures. Biggest proportions in United Kingdom, Belgium, Poland and Portugal. Lowest proportions in Sweden, Romania, Lithuania and Hungary. And here you would have needed some explanations. Low proportions in Sweden because people don't need dentures. Low proportions in Romania because people have not money to buy dentures they would need. But there are no explanations in this report. Emergency care, quite usual. During the last 6 months, about a fifth had had pain or problems with their teeth and other problems there. And this was true especially for old people, those with low education, low income and living in Eastern Europe. So the oral health situation in Europe doesn't seem to be so very good. And all this has cost almost 80 billion euro. So you wonder, is it worth it? Wouldn't our populations deserve something better? I think it's a very important question that is raised by this report. And why? Because there's still no proper cure for caries. We can go to the moon, we can transplant organs, we can cure difficult cancer diseases. But when it's dental diseases, it's the old ways of treating dental disease, extracting teeth, trying to replace lost teeth, different methods, different materials, different technical solutions, not much thinking about why, how to cure or do something for the reasons. More recently, lots of fillings. A filling lives between 3 and 8 years about. So during a lifetime you can get many fillings and it's a big industry. And it doesn't cure, it doesn't solve the problem. Also, the report shows that in some country people had counted that oral diseases were more expensive to treat than all cancers. And I think it's quite a lot of money that is used to something that could be prevented. Also, health services across Europe face cuts as debt crisis begins to bite. The dentistry doesn't see it so clearly. Those who have systems, oral care provision systems, see something about that yet. But we see that the situation is bad and essential medical treatments may be affected. Politicians are looking at this reddish part of the cake of expenses and think it's too much. On the other hand, we have an aging population, new treatments, quite a lot of care can be done, and in that piece of the cake, there's very little of the expenses of dentistry because most of it is used privately. But I think there is something politicians should think about. Where should this money to be used? We know that caries and periodontal disease can be prevented and managed today. and there are the traditional ways of doing it. There are different preventive programs, campaigns. There is water fluoridation in some countries. A lot of chairside education with dentists, and it was mentioned already earlier today that that's quite usual. But it's the most expensive part of it. The chairside education, individual education, is more expensive than things done for population on population-based basis. There is also a lot of knowledge of the best methods, best practice guidelines. We have very little studies on health economic aspects, what is worth money, but we at least know what works. And there's an example, the SIGN National Clinical Guidelines from Scotland, that is about preventing dental caries in children at high caries risk. And there is this big part of behavior modification that is the most important part. Children need to brush their teeth, or their parents need to help them. Sugary foods should be avoided, and so on and so on. There is the knowledge is there, and there are guidelines in other countries that are quite similar. Chairside tooth protection, you can use sealants, fluoride varnish, and other methods. Chief dental officers have collected some information on the caries experience, 1970s, 80s, and 2000. And you see, as Paul-Erik already showed also, that there has been improvements. In the Western Europe, the mean DMT value is around 1 today. In Eastern Europe, it's between 3 and 4. Big difference between these countries. You wonder why. And we know that lifestyle and good oral hygiene is a big challenge for poor, vulnerable immigrant families in the EU and in Eastern Europe. But the adults' situation is even worse. I have some figures on edentulousness from the Nordic countries, and you see quite big differences between Sweden and Finland, two neighboring countries. Of course, we can always say that it's the history that explains it, and it's true partly. There are today best practice guidelines in Sweden. Caries prevention in adults. This is a very interesting document. It cost a lot of money to produce it and find the evidence for these measures. I can warmly recommend the booklet. There are also some good news that are not in our little report. Good news from the south of Sweden. Practically no adults with removable dentures any longer. All social classes have received crowns and bridges when they have needed some kind of replacements. Yes. And I'm showing this because it shows that it's possible to get good results, but it needs efforts from the politicians, and you need money for that. That's obvious. What do we need in the EU? I think we need more cost-efficient oral healthcare systems, especially for the children, where the most of them have quite good health already. We might need a novel system for healthy lifestyle education when we think about these overweight problems. If we take the dental way of solving it, we would cut the stomachs for everyone individually and have controls every second year, and then redo these operations, cut a little bit more. But I don't think you would like to have that solution to this problem. And we need politicians who have courage to implement reforms. 2 recent pilot studies I was involved with. A study in preventive practices in the north of Norway. Outdated practices, no leadership, very, very bad programs. And another, Dominican Republic in the Caribbean. The dentist, where you can find the dentist in the yellow pages of the telephone catalog, and no system of care is there. and children have a lot of caries. So there the dentists say that they can't do this preventive work because people can't pay for it, and they think it's the responsibility of someone else to educate the people. And I think they might, right, and they are honest at least, saying that we can't manage this task. In oral disease prevention, simple methods are most important, and dentists are not necessary for this work. We have good experience from dental hygienists. We have good experiences from the school system that is covering whole Europe. Maybe it could be used more in this. And who is shaping the future? It's dentists' own associations that are very important today, and I'm not very happy with that, because I think dentists have been opposing, associations have been opposing many good initiatives that have been taken, because they feel threatened, that their profession is threatened. Consumer organizations, I don't think there are many people from consumer organizations present here. I would have wished there would have been some. Politicians are important. Insurance companies have something to say if they wish. Government officers, dental industry, and companies are an interesting partner. Academics, yeah, what can we say about them? I'm one myself, so yes. So I think we have to decide where to use the money.